So cervical cancer is a cancer of the neck of the womb, which is the bit of the womb or uterus that opens up to allow a baby to be born. The cervix is lined by cells which can become cancerous, and cancer just means uncontrolled growth of cells. HPV causes almost 100% of cervical cancers. But what HPV is a really common virus. There are two types of HPV. There's low risk HPV, which causes warts, and there's high risk HPV, which causes no visible lesions, so you wouldn't know you had it if it wasn't screened for. 4 out of 5 people will have HPV at some point in their lives, and in most it's a transient, harmless infection, and they wouldn't even know that they have it. But in some women, HPV persists, and the persistence of HPV can cause alterations in the cells that line the cervix, which then can put the woman at risk of cervical cancer. So just to reiterate, HPV is common. The vast majority of people who have HPV will not have cancer, but it is recognised as a risk factor for cervical cancer. We can't treat HPV. It's a virus like the common cold, and there's no treatment at the moment for viruses. We can, however, screen for HPV, and it's part of the cervical screening system in this country. A screening starts from the age of 25, and it's every 3 years till the age of 50, and then every 5 years until 65, where a woman is discharged. And the screening tests for HPV. And if a woman does not have HPV, then she just comes back in 3 years. If she has HPV, then that same sample is tested for abnormal cells. And if there are abnormal cells in the sample, so this is not cancer, this is pre-cancer and fully treatable, then the woman is referred for further tests, and the test is called a colposcopy. And all that colposcopy is looking at the cervix under magnification and samples taken. And then a decision can be made whether the little area in the cervix where the abnormal cells arise needs to be treated, or if it can be safely watched, because very often these changes will get better. The good news is that cervical cancer is potentially preventable. And there's 3 strategies really to prevention. One is education. The second is HPV vaccination. And the third is screening for the abnormal cells that, if undetected and untreated, can lead to cervical cancer. So education is being aware of the things that increase the risk of cervical cancer. For example, a lot of women do not know that smoking increases the risk of cervical cancer, and educating women not to smoke significantly reduces their risk of cervical cancer. Getting the HPV vaccination when you're young also significantly reduces the risk. And for example, if the HPV vaccination is given under the age of 17, then there is an 83% reduction in cervical cancer risk. So that's a very positive message. And then finally, whether you've been vaccinated or not, you will require screening, which starts from the age of 25, looking for HPV. And if HPV is present, looking for abnormal cells. And if the abnormal cells are present and significant, treating these. This combination, this 3-step combination, keeps women safe from cervical cancer. The commonest symptoms are bleeding after sex, bleeding between periods, bleeding after the menopause, or experiencing a persistent offensive vaginal discharge. Now, fair to say, most people with these symptoms will not have cervical cancer. They'll have other benign conditions, but it's really important that these symptoms are not ignored and the appropriate investigations undertaken to exclude cervical cancer.